Hello everyone! A very warm welcome to MJ Pharma. In today's video, you have to guess the correct function of commonly used disposable items in hospitals. From syringes to catheters, let's see how sharp your clinical knowledge really is. Ready for the challenge? Let's begin the quiz. What is a micro drip set used for? Answer A. Administering 4 fluids. Bionectar spike is used for? Answer B. Drug infusion. Foley's catheter is inserted in? Answer B. Bladder. What does a drip regulator control? Answer A. Flow of 4 fluids. Melton catheter is mainly for? Answer B. Urine drainage. Orogastric tube delivers food to? Answer A. Stomach. Nasogastric tube is passed through? Answer B. Nose. Where is a stomach tube placed? Answer C. Stomach. Endotracheal tubes help in? Answer A. Breathing support. Face mask is mainly used for? Answer A. Oxygen therapy. ECG electrodes help in? Answer A. Monitoring heart activity. Blood sugar random strips test? Answer A. Blood glucose level. Tegaderm dressing is used for? Answer A. Wound dressing. Nebulizer kit is used for? Answer A. Medication via mist. Artificial airways assist in? Answer A. Maintaining airway patency. Butterfly needle is used for? Answer C. Blood collection. Blood collection set is used for? Answer C. Blood sample withdrawal. 3-way stopper is used in? Answer B. IV line connection. Mcqs tape is commonly used for? Answer B. Securing dressings. Insulin disposable syringe is for? Answer B. Insulin injection. Disposable syringe is used for? Answer B. Injecting medication.